Hi, good afternoon, ma'am. I am happy to be showing with you the basic of drug education. I'm Michael Avellino from BPED 1C. In this video, we are covering four subtopics about drug education. But first, what is drug education? Kaki ka. Drug education is the planned provision of information, guidelines, and resources and skills relevant to living in a world where psychoactive substances are widely available and commonly used for a variety of both medical and non-medical purposes, some of which may lead to harm such as overdose, injury, infectious disease, or addiction. Here is the four subtopics. 1. Drug-related terms and concepts. 2. Effects of drug use. 3. Legal aspect of drug use. 4. Skills for drug-free life. First, let's differentiate drug versus medicine. Drug versus medicine. Drug. Any chemical agent that alters the biochemical or psychological processes of tissues of organisms. So it means if you ingest drugs, it alters the function or structure of any part of your body. While medicine, a drug with curative properties. Keep in mind that medicines are drugs, but not all drugs are medicine. Medicine misuse and abuse. Misuse. Use of a medicine for a purpose that is not consistent with medical guidelines, not following the doctor's prescription. These are the signs of medicine misuse. Taking too much, taking for reasons other than the reason they were prescribed, stopping a medication, accepting prescription medication from a friend. And this is the medicine abuse. Use of medicine that is not prescribed to feel high or to chase a euphoric feeling. Sign of medicine abuse. Ongoing and compulsive use despite negative consequences. Now, I'm going to introduce to you a general term that is called substance use. What is substance use? Use of psychoactive substances including tobacco and alcohol, the illegal drugs of abuse, inhalants, and other non-medical use of prescription medications. Now I'm going to show you a model which is called risk factors. But before that, I want you to make you realize that risk factors are factors that increase your susceptibility or vulnerability to drug use. Risk factors: genetic predisposition, 40 to 60%, personality, traits such as risk-taking, sensation-seeking, and impulsive behavior. Overall, health conditions, comorbid or coexisting health problems. Here is the substance use disorder, a chronic relapsing brain disease that is characterized by compulsive substance seeking and use despite harmful consequences. Earlier, I said in general, that is the risk factors. But if we're going to look the risk factors in school setting, risk factors in schools: school failure, low commitment to school, rejection by peers or social isolates, association with deviant and substance using peers. Now we move to the protective factors. These factors decreases your susceptibility and vulnerability. Protective factors: self-control, academic competence, school-based drug education, strong neighborhood attachments, parents' attitudes and the kind of home they provide, enriched environments, enforcement of limits and discipline, forming strong bonds with children and monitoring children. According to DSM-5, which means Diagnostic and Statistical Manual of Mental Disorders, 5th edition, does not use drug addiction or dependence, but rather it refers to problematic use of drugs as substance use disorder or as a substance-induced disorder. DSM-5 criteria for substance use disorder and severity scale. Hazardous use, social or interpersonal problems related to use. 3. Neglected major roles to use. 4. Withdrawal. 5. Tolerance. 6. Use larger amounts or longer. 7. Repeated attempts to quit or control use. Much time spent using. Physical or psychological problems related to use. Activities given up to use. 11. Craving. Substance use disorders severity. Mild, 2 to 3 criteria. Moderate, 4 to 5 criteria. Severe, 6 or more criteria. The cause of substance use. Personal health. Accidents, diseases, mental illness, depression, death. Relationships. Marital conflict, disrupted friendships, and child abuse, violence. Social functioning. Dangerous behavior, financial problem, employment difficulty, legal problems. Here's the question. Why are adolescents more vulnerable to risky behavior? Because we are still developing our brain. This was not fully mature until you age 25. What are the highest risk periods among youth? Research has shown that the key risk periods are during major transitions in the youth's lives. Elementary to high school, junior to senior high school to college, or when you're working. We have a law, and that is the RA 9165, which is Comprehensive Dangerous Drugs Act of 2002. We're just going to look at very important provision in that, and that is Section 15, Use of Dangerous Drugs. First offense, minimum 6-month rehabilitation in a government center. Second offense, 6 years and 1 day to 12 years imprisonment and a fine of 50,000 pesos to 200,000 pesos. And we proceed to the most important part of this presentation, and that is the skills for a substance-free life. There are 3 skills that we need to enhance, especially to the young people like us, and that is the assertiveness, decision-making, and resistance or refusal. First, let's start with the assertiveness. So we have the OFNR script. For acronym, it means observation, feel, need, request. For observation, steps to assertive action. State your observation. Tell the person how it made you feel without blaming. Express your need. State your request. Next is the decision making, and we have an acronym which is the DECIDE model. D. Determine the problem. E. Explore the alternatives. C. Consider the consequences. I. Identify your values. D. Decide. E. Evaluate. Basic rule. Stay away from situations where you can be tempted. And learn how to say no. Maintain eye contact and say no firmly. Watch verbal with non-verbal signals in refusing the offer. Use the broken record technique. Use the cold shoulder approach. Give reasons or excuses. Give helpful alternatives. And here are the helpful alternatives: praying, worshiping, studying, and become volunteers in organization. And that's all.